About Methotrexate brand names: Jylamvo, Maxtrex, Methofill, Metoject, Nordimet. Zlatal. Methotrexate is a type of medicine called an immunosuppressant. It slows down your body's immune system and helps reduce swelling inflammation. It's used to treat inflammatory conditions, including rheumatoid arthritis, psoriasis including psoriatic arthritis, Crohn's disease. It can also be prescribed for cancer. Methotrexate is available on prescription only. It comes as tablets, a liquid that you swallow, and pre-filled injection pens or syringes that you inject into your skin. Your specialist doctor may recommend injections if the tablets or liquid are not working for you. It can also be given as an injection to treat some types of cancer. This is usually done in hospital. Key facts: for conditions such as psoriasis, rheumatoid arthritis, and Crohn's disease, you'll take Methotrexate once a week. It's important to take it on the same day each week. You'll get a patient card to record the details of your weekly dose and the day you take it. Keep this with you and show it to any healthcare staff involved in your care. You'll also usually get a booklet to record how much you take and your blood test results. Taking Methotrexate can mean you're more likely to get infections. Ask your doctor for urgent advice if you get an infection, such as COVID-19, or if you've been in contact with anyone who has chickenpox or shingles while taking Methotrexate. It's important to have any vaccinations when you're invited. Tell the person giving the vaccine that you take Methotrexate. To make sure the vaccine is suitable for you, it's best to avoid too much caffeine and foods that can cause an infection, such as unpasteurized milk and cheeses. If you're taking high doses, check with your doctor that you can drink alcohol. Who can take Methotrexate? Most adults and children can take Methotrexate. Who may not be able to take Methotrexate? Methotrexate is not suitable for some people. To make sure it's safe for you, tell your doctor before taking it. If you have ever had an allergic reaction to Methotrexate or any other medicine, or pregnant, trying to get pregnant, or breastfeeding, have severe liver or kidney disease, or blood disorder, have an infection, have mouth ulcers, or have been diagnosed with a stomach ulcer, or duodenal ulcer, or due to have a live vaccine. This includes the live flu vaccine usually given to children. You may have a chest x-ray and a breathing test to check your lungs before starting treatment. These tests will help show your doctor whether Methotrexate is suitable for you. How and when to take Methotrexate? If you take Methotrexate once a week, take it on the same day each week. There's usually a reminder on your pill packet and patient card telling you which day to take your medicine. Dosage: for inflammatory conditions. For inflammatory conditions such as psoriasis, rheumatoid arthritis, or Crohn's disease, the dose of Methotrexate will vary. This depends on your condition and blood test results. Always follow the instructions from your doctor. For rheumatoid arthritis, the usual starting dose for adults is 7.5 mg, taken once a week. This can be slowly increased up to 20 tablets or 25 pre-filled injection pen or syringe once a week. For psoriasis, the usual starting dose for adults is 2.5 mg to 10, taken once a week. It can be slowly increased up to 30 mg once a week. For Crohn's disease, the usual dose for adults to prevent flare-ups is 10 to 25 mg, taken once a week. This is often called a maintenance dose. If your child is prescribed Methotrexate, the doctor will use their height and weight to work out the right dose. How to take it? How to take Methotrexate tablets: swallow the tablets whole with a drink of water. You can take your tablets before or after food. Wash your hands after touching the tablets to remove any traces of Methotrexate powder. Your doctor will tell you how many tablets to take each time. You may have to take up to 10 tablets to make up your dose. How to take Methotrexate liquid? Always use the oral syringe comes with your medicine to measure your dose. It's important to use this syringe so that you get the right amount. If you do not have one, ask a pharmacist for one. Do not use a kitchen teaspoon as it will not measure the right amount. It's a good idea to have a drink of water after taking your medicine. Having Methotrexate injections: you'll usually go to your GP surgery or a hospital outpatient clinic once a week to have your injection. Alternatively, you may get a pre-filled injection pen or syringe for you to use at home. Your doctor or nurse will show you how to use this. Protect your skin from sunlight. Your skin may be more sensitive to the sun while you're taking Methotrexate. Stay out of bright sun and use a high-factor sun cream SPF 30 or above even on cloudy days. Do not use a sun lamp or sunbeds. Methotrexate treatment for cancer: if you're having Methotrexate treatment for cancer, a doctor or nurse will usually give you an injection. You may need to have treatment more than once a week, and this will be done in hospital. How long to take it for? If Methotrexate works for you, you may need to take it for several years to control your symptoms. If you forget to take a dose, take it as soon as you remember the next day or the day after. Contact your doctor or the clinic for advice about what to do. Never take 2 doses together to make up for a missed dose. If you take too much, taking too much Methotrexate can cause serious side effects. In some cases, it can be fatal. Store your weekly Methotrexate separately, away from any other medicines that you take daily. Test during treatment. When you first start treatment, you'll have a checkup and blood test to check your blood, liver and kidneys every 1 to 2 weeks. These tests are to check if the methotrexate is working and if it's causing any side effects. Your doctor may increase or decrease your methotrexate dose, depending on the results of your tests. It's important to record how much methotrexate you take in the results of your blood test. You'll usually get a booklet for this. Once you and your doctor have found the right dose, and your treatment is working well, you'll have a checkup and blood tests every 2 to 3 months. Side effects of methotrexate. Like all medicines, methotrexate can cause side effects, although not everyone gets them. Sensitivity to sunlight. Your skin may become very sensitive to sunlight while you're taking methotrexate. This can cause a reaction that looks and feels like sunburn. To reduce the chance of this side effect, stay out of bright sun. Use a high-factor sunscreen SPF 30 or above and wear clothes that protect you from the sun. Do not use a sun lamp or sunbeds. Common side effects. These common side effects of methotrexate may happen in more than 1 in 100 people. There are things you can do to help cope with them. Loss of appetite, feeling, or being sick, stomach pain or indigestion, diarrhea, headaches, feeling tired, or drowsy, hair loss. Speak to a doctor or pharmacist if the advice on how to cope does not help, and a side effect is still bothering you or does not go away. Serious side effects. Serious side effects are rare and happen in less than 1 in 10,000 people. Tell your doctor or call 111 immediately if you get yellowing of the whites of your eyes, or yellowing of your skin, although this may be less obvious on brown or black skin. These may be signs of liver problems, a persistent cough, chest pain, difficulty breathing, or you become breathless. These may be signs of inflammation of your lungs, swollen hands, ankles or feet, changes to how often you pee, or not peeing at all. These may be signs of kidney problems, a high temperature, chills, muscle aches, sore throat. These may be signs of an infection, bleeding gums, blood in your pee, vomiting blood or unexplained bruising. These may be signs of a blood disorder. Serious allergic reaction. In rare cases, it's possible to have a serious allergic reaction, anaphylaxis to methotrexate. Long-term side effects. Methotrexate may increase the risk of problems with your liver or lungs, especially if you take a high dose. Your doctor will monitor you very closely, and any concerns or problems will be found during routine checkups. Methotrexate and pregnancy. Methotrexate is not recommended in pregnancy, as it can cause birth defects. If you're taking methotrexate and want to get pregnant, speak to your doctor. They'll discuss whether you need to switch to a different medicine before stopping your contraception. If you become pregnant while taking methotrexate, do not stop taking your medicine but speak to your doctor as soon as possible. They'll review your treatment and help you decide what to do next. Your doctor will only prescribe methotrexate for you while you're pregnant if the benefits of the medicine outweigh the chances of it being harmful. Methotrexate and breastfeeding. There is not much information about methotrexate and breastfeeding, but it shows that methotrexate passes into breast milk in tiny amounts. However, since methotrexate can cause some quite serious side effects in rare cases, your doctor or specialist will advise what's best for you and your baby. If your weekly dose of methotrexate is 25 mg or less, it may be possible to breastfeed. However, you must not breastfeed for 24 hours after taking your medicine. Your midwife or health visitor can give you advice about how to feed your baby while you wait 24 hours. If your weekly dose is more than 25 mg, your doctor will talk to you about what's best for you and your baby. You may still be able to breastfeed, but it will depend on your dose of methotrexate and any other medicines you're taking. If you breastfeed while taking methotrexate, your baby will have blood tests to check for any side effects. If you notice that your baby is not feeding as well as usual, is being sick, or has diarrhea, seem to be getting infections more regularly, or if you have any other concerns about your baby, talk to your health visitor, midwife, or doctor as soon as possible. Methotrexate and fertility. Methotrexate may reduce fertility. It may damage sperm in men and egg production in women. Methotrexate can cause birth defects if taken during pregnancy. Ask your doctor about changing to a different medicine before you stop using contraception. Cautions with other medicines. There are many medicines that affect the way methotrexate works. Always show your patient card to healthcare professionals who may not know about your methotrexate treatment to alert them about your once weekly dose. For example, if you go to hospital or have a change in your care, children taking methotrexate must not have a live children's flu vaccine. This usually applies to children aged 2 to 17 years. Adults are given an inactivated flu vaccine, and this usually does not cause problems with methotrexate. Tell your doctor if you're taking any of these medicines before you start taking methotrexate. Non-steroidal anti-inflammatory drugs and NSAIDs like ibuprofen, or cough and cold remedies containing an NSAIDs, cotrimazole, trimethoprim, or other antibiotics for bacterial infections. Medicines that make you pee. More diuretics, such as indapamide or bendraflumethiide. Epilepsy medicines such as Penetuen or levetiracetam. A medicine used to treat asthma. Medicines used to treat indigestion, such as omeprazole. Folic acid or vitamin supplements that contain folic acid or folate. This is because your doctor may prescribe folic acid to take with your methotrexate. These are not all the medicine may affect methotrexate. Check the leaflet that comes with your medicine. Mixing methotrexate with herbal remedies and supplements. Do not take vitamin and mineral supplements or any other products that contain folic acid folate if you're already taking folic acid prescribed by your doctor. Check the ingredients on the labels of any supplements. There's not enough information to say whether it's safe to take other herbal remedies or supplements together with methotrexate. They're not tested in the same way as pharmacy and prescription medicines. They're generally not tested for the effect they have on other medicines.